Welcome, aspiring nurses, to your guide to medical English basics. We'll cover anatomical terms, medical conditions, diagnostic procedures, and important treatment protocols. Regularly studying medical dictionaries, flashcards, and vocabulary lists aids retention. Incorporate terms daily through writing and speaking exercises for reinforcement. Understanding prefixes, suffixes, and root words helps decipher new medical terms. Let's explore some essential anatomical terms and their functions. Heart, the organ that pumps blood through the body. Liver, an organ that detoxifies chemicals and metabolizes drugs. Lungs, organs that take in oxygen and expel carbon dioxide. Next, we'll delve into common medical conditions. Hypertension, this refers to high blood pressure. Diabetes, a metabolic disease causing high blood sugar. Asthma, airways narrow, swell, and produce extra mucus. Now, let's look at important diagnostic procedures. MRI. Powerful magnets and radio waves create detailed body images. Biopsy. Taking a small piece of tissue for examination. Ultrasound uses high-frequency sound waves for internal imaging. Finally, understanding treatment protocols is crucial. Chemotherapy. Cancer treatment using drugs to destroy cancer cells. Radiotherapy. Controlled radiation doses treat cancer. Physiotherapy restores and maintains a patient's mobility and function. Expanding these terms enhances communication skills for better patient care. Here's a short list of essential medical English vocabulary. Prognosis, the likely course or outcome of a medical condition. Diagnosis, identification of a disease or condition. Pathology, the study of diseases and their effects. Symptom, a physical or mental feature indicating a condition. Therapeutic, this relates to the treatment of a disease. Prescription, a doctor's written order for medication. Inpatient, a patient who stays in the hospital for treatment. Outpatient, a patient receiving treatment without staying overnight. Acute, a condition with rapid onset or a short course. Chronic, condition persisting for a long time or constantly recurring. Anatomy, the study of the structure of the human body. Physiology, study of how the body and its parts function. Radiology, using imaging techniques to diagnose and treat diseases. Cardiology, branch of medicine dealing with the heart and blood vessels. Neurology, dealing with disorders of the nervous system. Oncology, the study and treatment of cancer. Pharmacology, the study of drugs and their effects. Surgery, treating diseases, injuries by operative methods. Hematology, the study of blood and blood disorders. Keep learning and practicing. Your dedication makes a difference.
Want to learn more about OET and medical English? Like and subscribe to MedGenius.